Let's talk about that a little bit, about getting your life back through using the product, because Herbalix is a different type of drainage in that is skin based. You built it that way to be applied to the skin because of what you saw. I saw the demonstrations you were doing at the conference where you're looking under the knee, around the knee, of course, for the edema, for the swelling, for all of that. So talk about how'd you get started with understanding what to utilize in Herbalix so that it would work on the skin to help with lymphatic drainage?
Well, the first thing, because of gravity, and I look at a Liga scan and I see somebody that their sulfur conjugation says maybe 75% lack of sulfur conjugation. My first question on my mouth is, how's your sweating pattern? They go, well, I don't sweat. And I go, oh. So we have in the medical world diuretics. Mm-hmm. So my products using the skin create a vasodilation because of the natural seaweed that's in the product. So when you have a stronger salt outside the body, it can collect the fluids through. It can actually attract the fluids. Now with the coriander seed, I found it can absorb aluminum, and when you absorb aluminum, like EDTA at AL15, it will pull the other metals through. Now, the sweat duct always leaves atoms of salt, so it stays open. And so there's this osmotic transfer, a stronger salt with my product, that I'm able to track the body fluids into the paste that you wear at nighttime when the lymphatics slow down. You can wear it, use it day and night. And so by getting the foot to restored, seeing the bottom of the foot, the circulation, it's nice color, there's no calluses. Now I can start teaching them how to go through the lymphatic system topically up to the knees, into the inguinals. And so after the foot, let's say this way, when I start, I test the whole system. I palpate, check bottom of the feet, I test their knees. If they're sore, they go, ouch. Okay, we're backed up to there. Then I go to the hip point. I press the hip point. You remember pressing hip point. A lot of people go, ow. Okay, we're backed up to there. Then I go, how's your back, your spine? It hurts. Of course, the spinal fluids are stagnated there. And so if their stomach is pulling, it's pulling on the nerve ending. And so that the nerve is compressing on the nerve endings and on the lymphatic fluids. So I have to actually relieve like a hose, untwist it, all show them, and they self-manage it themselves. Mm-hmm. But that's just 7 steps, one part. I have one for the underarm where it reaches up into the brain, the thyroid, the gums of the teeth, and the breast. So that is, and it's very simple. They self-manage. And people think, like commercials, that your heavy metals are going to disappear in 30 days. How long is it going to take? I can't tell how, because everybody has different excretion rates. But I tell them that the things are 5 to 10 years to get rid of lead and cadmium sometimes. Mercury is a real tough one. So we never get rid of metals. We never get to zero. But if you can mobilize them, you can have that pizza. Just know that you're going to need a product to accelerate the removal of that. Now, something interesting that contrasts that when people get an MRI, they're using they're going for cancer treatment and they're getting a chemo. And all these have a die-off. And because they're metals, you can go to an oncology waiting room, and everybody's got swollen feet. And they don't know how to get it out. They don't teach. The doctors don't know how important the foot is. And they'll just say, well, just shave off the callus. I say, no. There's a way to do it, because I use a product called shungite. It's from Russia. It's it absorbs radiation, it absorbs heavy metals. And just putting that on bottom feet helps to restore the foot so it can start sweating again. So you put it on, you wear a sock at nighttime, and you'll have these nice little movement, and so if your shoes don't fit and you the shoelaces don't tie very well, you got to think why, and I don't understand why doctors haven't figured this out, or podiatrists. Right. I mean, it doesn't make sense to me.
No, very few doctors now ask why. It doesn't matter. And patients also should ask why, but why would I have that? You could go to the normal, it's genes, it's just this, it's hereditary, who knows, who cares, we'll put you on this drug and hopefully it'll fix it. But that why question is the most important in the world, I say. You got to have a why in life as well, purpose.
Yeah, and I'm finding a lot of these medications, the black box has a lot of side effects.
Tons.
And so when we're able to have the right detox protocol and show them a liquid scan, a lot of times I've been told that I don't need this medication anymore, or my thyroid medication, it's been reduced. And I ask people, would you like to pay $1,200 for your medicines, or be guided on a detoxification and a lifestyle change and spend what, $100, $200 a month? And we'll keep you out of the wheelchair, unless you want to ride in a wheelchair all day long. But that's why we're in this field. The medicine's not getting their job done.
No, they haven't been doing it for a while, and it's not to knock them. I think the toolkit is very, very limited. So when you have when you show up to a job in a house and you only have a hammer and it requires a wrench or something, you're just going to bash away at a pipe until something happens. And I feel like many doctors may have the best intention, but we're giving them is a very, very limited toolkit. That's how my father started. My father started in conventional medicine, but he quickly realized this isn't helping patients. I have a small toolkit that's managing their disease, and slowly they're progressing worse and worse. He went out to the world and said, I need more tools. What else is out there? And what he learned is, damn, there are a lot of tools out there in the world, both past, present, future, so many. And understanding and drainage was a big part, because it's not even what you introduce into the body. There's too much being introduced. It's what you take out of the body that's more important. And that's where I feel many doctors can go, and hopefully some are listening right now and say, okay, I understand. I need more tools. And a lot of those tools are about taking things out of the body, allowing the body to self-heal, not me manage that without taking anything else out and adding more drugs, more things that are going to actually exacerbate over time the situation.
Yeah, Einstein has that saying, energy is neither created nor destroyed. The same thing with aluminum. It just changes the form.
Yeah.
But when it's tagged, you're it. When you have all these heavy metals, unfortunately, I do think what we're doing now sometime will be brought into the medical world. Mm-hmm. And hopefully it will, because it has, we have to start looking at helping the younger individuals, because when the liquid scan started to take the test from blood, urine, hair, and do the algorithm for it, it was done in the 70s and 80s when these devices were starting to come up and be developed. But now we're looking at the sources of nutrition in our food is getting lower and lower. So that's why people think they have to supplement.
Right.
And that's why people are reaching out to organics, growing their own garden. So they know, they can tell which plant supplements them with silicon or with, whatever they need, zinc. I will mention one thing, that a lot of things I see on lack of zinc, and Hal Huggins kind of alerted me to this, that he had done 199 vegans, and he couldn't get them to heal, and he just couldn't. And so I remember that. So when I saw that on the liquid scan, we have the questionnaire, do you have a dietary, and a lot of people would say, well, I try to avoid meat or whatever. So they have to find another source, like oysters or some other way to get zinc in their body. And so this is, when you mention this to a medical doctor, they've already felt they're burned out. They've already done their training. They're still paying off their loans. And we're trying to tell them there's this other part, the trash. We're going through the trash and we're telling you it's not being brought out of the body.
Yeah. No, that's always an analogy my father used to make. It's just a messy house, right? And you have garbage in it, and then whenever you have garbage, you have pests, because pests, cockroaches, mice will come. And what we do is, instead of saying let's clean the house and the pests will remove, we set traps, which are drugs and antibiotics and things like that, without ever looking at the terrain or how the house looks. You got garbage and nothing being taken out. But when you clean the house, when you can move that garbage out, clean the junk out, all the scraps of food that are sitting in the kitchen, they're being picked on by these opportunistic pests, which are pathogens in our lives, then you're going to have a very easy time getting rid of them, because the environment does not suit them anymore. They don't have the scraps, but you need to drain, you need to detox to do that. And too few people are really kind of looking at that, especially from the drainage part and through the skin.